Okay, we're gonna show you all how to prime your primary line and also your secondary. We'll start with the primary. First, you wanna get your bag of fluid that you need. You always wanna check that with your doctor's order, you know, to make sure that it is what the doctor ordered. You'll want to open your bag here. If it's hard to open, you may need your scissors to get it out of there. So then you'll want to inspect your fluid, make sure there's no particles or anything floating around in there. Make sure it's clear. You might want to squeeze your bag just to see if it leaks or anything. There may be a little condensation on the outside, so it may be wet when you take it out of that plastic, so just kind of wipe that off and then inspect to make sure there's nothing actively leaking out of it. There is a barcode on here that you'll need to scan when you take this into the patient. You want to scan your patient's bracelet and then scan the actual bag, and that way you're making sure you're hanging the right medication or the right fluid. Also on here there should be an expiration date, so you'll want to check that and make sure it is not expired. So all that is good with your bag. Then you'll want to get your primary tubing. This is what it looks like in the bag. It should say on the front that it's a primary tubing or continuous flow tubing. Should have your drop factor on the actual packaging, so you'll be able to tell what that is. This one's 10. There should be a little perforation on one side so that you can open the bag easily. Just open it up. Now you'll have a roller clamp on here. It is always open to begin with. So the first thing you'll want to do is move it up a little bit closer to where the spike is, just it's a little easier to handle. And you'll want to close it, so you'll want to push it down to close it. And then as long as your little cap is on the end here and everything, it's sterile, so you're good to go on that. You want to take your bag. You want to pull the little tip off. This tip's where you want to spike it. This area here is a port for like medication to be added and things like that, so we don't do anything right now with that port. So just pull that. Pull the top off of the spike. Then you'll have to keep both these ends sterile. You want to hold on to this. I kind of hold it up close to the top so you've got a good firm grip on it. And then insert the spike. You may have to kind of twist it to get it to go in good. And hang your bag up. Then before you undo anything, you'll want to squeeze the drip chamber to get a little bit of fluid in the chamber. There is a little mark on there. It doesn't have to be exactly to that mark, but you'll want it somewhere in there so that you're able to see the drips and you can count your drips. So then you'll want to start priming your tubing. Now what you'll want to do is just very slowly open your roller clamp, because sometimes it just comes flying out and it's a little hard to control. So just slowly start the fluid dripping. And then you'll see your fluid starting to roll down there. When it gets to your little port here, you'll want to have it upside down and flick it as it comes through so that you're getting all those bubbles out. Sometimes as the fluid gets to the clamp, it'll kind of slow down. You may have to open it just a little bit more to get it past that clamp. There it comes. As you can see, the fluid's coming on down through there. Now your tubing will have either 2 or 3 of these ports. I think your all's has 2. That you have to make sure that are upside down when the fluid gets to it, and then you start flicking it to get those bubbles out. We're still coming through here. A lot of times I'll have a garbage can or something here handy so that when it starts dripping out, it'll drip into the garbage can, not all over the floor. And you can always turn it completely off and then go back and,